Okay, so again, internal jugular vein, subclavian vein merging to form the brachiocephalic veins into the IVC. If we cruise down into the abdominal cavity, so here we have abdominal aorta and inferior vena cava side by side. Here's our kidney. Going into the kidney, we're going to see coming off of the aorta there, our renal artery and our renal vein. Here's the ureter coming from the kidney all the way down. This is the urinary bladder here. I know we're supposed to be doing blood vessels right now, but whatever, we might as well do it. This is the urinary bladder. If we follow and look at the ends of our aorta and our vena cava, here's our abdominal aorta. It's going to split, and that's going to be your common iliac artery, and the vena cava is going to do the same thing. It's going to split into the common iliac veins, and those continue down into the thigh. Now they are cut on this side, so they're not very colorful and pretty on this side. Test this out of the way. So, well, we'll try to do it over here. So they're here, but they're not colored and pretty. So this big blue one, of course, is going to be the femoral vein, and then you can see running along with it is going to be the femoral artery, but it's not. So here's femoral vein and artery here. They're just not very colorful and pretty. All right, side by side with that femoral nerve. Okay, so here we have our trachea. There's a nice hole in it. And at the top end of the trachea, it's still kind of covered in tissue, but this big lumpy thing up here is the larynx, which we have cut so that we can see the epiglottis. So this is the flap that's going to close and cover the airway. If you lift that up, you can see the little kitty vocal folds in there. Right, so we can go down the airway this way, or if we continue down the back side, the esophagus runs right behind, right posterior to the trachea. Yeah. So the esophagus is going to, the trachea is going to come down. We're not going to see the split on here because we'd have to remove the heart, but the lungs, they have a lot more lung lobes than we have, but this is all lung up in here. And then this big dome-shaped muscle sitting right below the heart and lungs is going to be the diaphragm. All right, so in the digestive system, right, we've given up on the parotid gland. This big, large gland here on the underside of its neck is going to be the submandibular salivary gland. We already covered the esophagus running behind the trachea. It's going to run all the way down through the diaphragm to the stomach. So this is the stomach here. Now the stomach has been cut open so that you can see rugae inside of it. They're not the greatest rugae, but you can see the little wrinklies in there amidst all the food chunkies that are the little rugae, the gastric folds. Hanging off of the greater curvature of the stomach is the little apron of fat that is the greater omentum. This is, of course, the liver. Embedded within the lobes of the liver, we're going to find the little gallbladder. If we reflect the greater omentum back, now over here on the left side of the stomach, this very large organ here is the spleen. Their spleen is huge. Right. If we reflect this back, right, we can see the pancreas, and the pancreas is going to extend all the way across until it connects ultimately up to the spleen. And the pancreas originates out of the curve of the duodenum. So if we look at our stomach, right, and we follow it around, here's the curve that is the duodenum. And then we can see, if we look up under here, here's the pancreas originating right within that curve. Right? And then the duodenum is going to give rise to the jejunum, which is going to coil about in here and ultimately become the ileum. Now, we're not going to worry about exactly where that distinction occurs, but what we're going to do is find our cecum of our large intestine. So sometimes it's easiest if you start at the rectum end and work your way back. So here's our cecum. So here we can see the last part of our small intestine, our ileum, connecting in right there at the cecum. And then from the cecum, this is all colon until we get down to the tail end of things where it becomes the rectum. Within the small intestine, if we fan out the small intestine, we can see the mesenteries that are holding all of the blood vessels going to our small intestines and anchoring them to that back wall. We already covered kidney, ureter, bladder. Now this is a little boy kitty, and we have already opened up the scrotal sac. So down here is the skin that was holding on to the little, so they were tucked inside there. They have been extracted. So here is a testis. Now this one has been opened up, and if you zoom in really close to this guy, you can see, if I can get it to sit still. If you zoom in really close on here, you can see all the little coilies within the tube, or the super coily tube within that, coming from, so that's basically your epididymis wrapping around here, and then coming up to give rise to your vas deferens, which is going to lead up and into the pelvic cavity. The little kitty penis, now his penis got a little bit cut, oops, so it's a little shorter than it should be. It's missing its pointy little tip. But that's what's left of this poor little kitty's penis. And if you feel the penis, you can feel the little barbs on there. It has a little spininess to it. Is that all we have? Oh, I should have had someone with a female cat leave their female cat out. Oh, well.
I just missed the one part.
What'd you miss?
The entire intestines.
The intestine.
Okay.
You have that, right?
You got that.